Two patients can receive the exact same stem cell protocol and yet experience very different outcomes. Today we're going to talk about why most stem cell injections miss the target. So we have identical biologics, we got similar diagnoses and equivalent procedure codes, and yet one patient improves dramatically, whereas the other one leaves frustrated and wondering why nothing's changed. And often the difference is in precision. We're talking about precision medicine. Just a few millimeters can determine whether an injection actually reaches the damaged tissue or if it completely misses the target. This is Dr. D with Operation Phoenix. Medical literature repeatedly demonstrates that the traditional landmark guided injections have variable accuracy. So in other words, whenever you have your provider that is looking for the landmarks on the surface of the body, the accuracy varies tremendously. However, as you can imagine, ultrasound guidance consistently improves procedural precision across multiple joints and soft tissue applications. In other words, once you bring in the ultrasound, the guidance is so precise that now we're able to get the target to pinpoint accuracy, to the precision that we're really seeking in this type of medicine. So this is why at Operation Phoenix, our medical team is going to be utilizing ultrasound-guided injections for our advanced regenerative procedures. Stem cells, exosomes, secretomes, and so on. We really want that pinpoint accuracy. Blind placement is outdated. Real-time visualization changes everything. Live ultrasound technology allows us to have direct visualization of tendons and ligaments, the actual joint spaces, the bursa, which are the packets that are around all those joint spaces, the fascial planes, all those tissues in between the muscles. These areas of degeneration we can see on our ultrasound, areas of active inflammation, and then, most importantly, nearby vessels and nerves. This is so critical because I've seen people that even with the right approach go right through the brachial plexus and macerate the hell out of it. We want to avoid that. So when you're going through with ultrasound to deliver the tissue, every structure is actually identified in real time, and the needle is placed precisely where the intended target is. You can actually see the fluid going into that damaged tissue in real time. So we're now working with millimeter level control, and that's fundamentally going to change your procedural accuracy. Research that was published in the British Journal of Sports Medicine demonstrated significantly that there was greater accuracy with ultrasound-guided shoulder injections compared with just the landmark. Additional studies actually showed that knee injections had ultrasound guidance improved accuracy across every injection. So it didn't matter who the provider was, what time of day it was, whether they had lunch or not, if they were happy, sad, or whatever. It took out all those variables, and we had improved accuracy across every injection point that was analyzed. Evidence supporting the ultrasound guidance continues to expand throughout interventional medicine. A review that was published in Clinical Interventions in Aging, it showed that shoulder injection accuracy increased, get this, landmark 65.4%, ultrasound guided 97.3%. Which one would you rather have? It's actually substantial differences that we're seeing in outcomes, and the literature bears it out. So modern interventional medicine is increasingly moving towards visualization-based procedures because the anatomy is dynamic, it's individualized, and it's almost impossible to accurately target blindly. Advanced regenerative medicine requires more than just having the biologic products, and we do have some of the most superior biologic products, which I'll break down in future videos. But most importantly for today's discussion, technical execution matters. Ultrasound guidance allows dynamic needle tracking, direct identification of tissue pathology, and avoidance of critical surrounding structures during the procedure itself. So we're avoiding the blood vessels, we're avoiding the arteries especially, we are avoiding the nerves. Now this creates a higher level of procedural sophistication and anatomical precision. Because in medicine, millimeters matter. Our team brings this level of technology directly into the patient's environment, directly to your home. So we have portable, high-resolution ultrasound. And by the way, these are some of the best probes. I've used multiple ultrasound probes before, bedside as a former ER doc. And I'm telling you that the ultrasound probes we have are really the best in the market. So we chose the best equipment to bring this in so that we can have the best delivery. So our portable ultrasound, it's high resolution, it enables precision-guided regenerative procedures, and that's in the comfort of your home. We also combine that, it's not just about the technology, but we have concierge level care. And so we have the advanced imaging, sophisticated interventional techniques, the best tissues in the market, and concierge white glove care for you. Now, very few providers, mobile or otherwise, operate at this level of procedural precision. So our patients, you, receive advanced regenerative treatment without having to go to the crowded clinics, those waiting rooms where they have the outdated magazines, you have to listen to everybody and their sister talking on their cell phones, and you certainly don't have the fragmented experiences. We keep on top of your care, and we make sure that you get that white glove service every time. We want you to have a fantastic experience working with us. So let's summarize. The future of regenerative medicine is precision-guided care. Visualization is now replacing estimation. Accuracy is replacing approximation. And technology is elevating these procedural standards. Blind injections belong to another era. We'll let them be. When anatomy can be visualized in real time, the level of medicine changes entirely.